Hello, everyone. I'm here at the PSI booth at ICFP, and my name is Andrea Novella. I am the Global Digital Health Advisor for the Social Business Unit at PSI. And today we're talking about people-powered care and pleasure, and I'm joined by the founder of the Pleasure Principles and the Pleasure Project, Anne. Thanks for joining us today, Anne. So today it's all about talking about how pleasure is really one of the opportunities that we can deliver on universal health coverage and why it's so important that we start to flip the script from disease to wellness. So tell me a little bit more about the work that you are doing and how this ties into everything that we're doing as a community.
The Pleasure Project is all about reducing the silence and stigma around pleasure, because really, bizarrely, it's quite strange to explain to people who aren't working in this world that these conferences and the world of sexual and reproductive health is kind of obsessed with bad sex and and of course, we need to talk about all the important P things, people-powered prevention, but we also need to talk about the other P, which is pleasure, because pleasure is arguably the key reason that people have sex around the world and is a key component of sexuality. But instead, what we tend to talk about is all the negative consequences of sex and of, death, danger, and disease. But what we have been advocating for at the Pleasure Project for now the last 2 decades is really recentering the conversation around what we want from sex. So, kind of lifting our eyes a bit higher and thinking about, when people have pleasurable sex, about people describing their most pleasurable sexual experiences, and then trying to get people to be moving on that pathway towards an ideal experience, not just avoiding the negative experiences. Because it's obvious to me, but I think how can people really know what they want to do, or if they're only ever told what they shouldn't be doing?
That makes so much sense. And I think that it makes sense probably to a lot of us, if not all of us. But the importance here that I see is the building of that body of evidence as well. And we had the opportunity to work together with our Pleasure Bot in Kenya, where we tested the difference in terms of results from what we were doing with a pleasure-driven approach versus a fear-driven approach. And if you recall, we found up to 126% greater cost effectiveness in driving users to engage with our sexual and reproductive health chatbot when we took this approach. I'd love to hear more about examples of this body of evidence that we're building as a community and maybe sharing with others how they can contribute to that.
There's more and more examples building now because there's a small but growing body of evidence that shows a range of different beneficial impacts of being pleasure inclusive in sexual health. So you talked about the your experience at PSI, also the Treasure Your Pleasure campaign that International Planned Parenthood Federation Africa region is running has found a far bigger engagement on social media from actually having an honest, holistic conversation about sexuality and pleasure. And also, it kind of totally makes sense, because if you think about when we talk to people about learning to drive or learning to cook, or we'll talk about all the benefits of that and how it could be a great skill, but actually there are some risks that you need to be aware of. But by far the most significant piece of evidence, and we had a presentation here at ICFP on this in our pleasure session, was a systematic review that we did with the World Health Organization. And, we looked at, so what a systematic review does is it looks across all of the evidence, and we looked across all of the evidence of the past 15 years to answer the question, does pleasure inclusive sexual health improve sexual and reproductive health? And we found it significantly and positively increases sexual health outcomes. So it's not just about bringing people to the website or bringing them to the communications campaign, because of course the bigger prize is improving sexual health outcomes. So outcomes included increased condom use, more HIV testing, more reported behavior change. And so the systematic review looked across all 7,000 studies for the last 15 years that hope to have an impact on sexual and reproductive health. And then we selected the ones that were pleasure inclusive, and there was just 33. So a smaller number, but still 33. what's really exciting about all of those is we screened for studies that compared one intervention to another, so like an experimental trial or a randomized control trial, and we isolated the pleasure component. So they were either a sexual health intervention, I don't know, say a sex education program that would be the usual kind of sex education, and then the same intervention with the same group but with pleasure. So it took out all the counterfactuals. And, it's really, really striking that the results showed a significant positive impact. And WHO came out really strongly on this. And I think if we were at this conference and that research had come out and it was a new pill or a new vaccine or a technology, everybody would be buzzing around this significant positive impact because it's really up there with some of the other interventions that have had that kind of result. But what's really important, I think, that is it's not expensive. We don't need to build a new series of health clinics. It's just about flipping the narrative, changing the conversation, us, actually starting to incorporate more conversations about joy, desire, well-being.
That's great. That's great, Anne. And actually, one of the things that I've heard mentioned at a couple of places here at ICFP has been about how this fear based approach is actually quite disempowering. And the other thing that I've heard mentioned is this talk about how we should also be considering that pleasure is in and of itself a health outcome. So, in one way, yes, definitely, it's helping us to improve the traditional health outcomes that we're looking at, but thinking through how that could just be considered as a health outcome in and of itself. Love to hear a little bit more about your thoughts on that one.
Really interesting thought. I mean, I think it's also important for us to remember that good, safe sex can be good for your health. And there's a range of outcomes that have been measured, like heart disease, reduced heart disease, improved immune response, but also improved mental health, reduction in stress. So there's something about good, safe sex improving our health, which is really needs to be studied more. I think it would be really good to, rethink what kind of indicators we're aiming for. And I feel strongly about that in terms of gender equity. So if you look at kind of the SDGs or gender equity indicators, I mean, I've gone through all of the SDGs and all of the indicators, and pleasure's not in there. And you'll see that, I don't know, I think it's quite a low bar, right? The indicators will be about reduced violence or being able to, leave home more. But what about, what we do after that, right? What's our vision, right? In terms of happier people who have more joy in their life, and we may take us some time to get there globally, but actually having these, this higher vision. And I think we have been doing some work on how you measure pleasure. So it's a challenge, right? Because I think, we all have the capacity to, feel pleasure if we choose to do that, but we're all going to feel it, and, in all many different billions of ways, right? And, I have to say that the brain is the biggest sexual organ. So, to actually measure people's pleasure or satisfaction in their lives, in each different encounter, is, it's going to take some time to come up with those scales. But there are some tools out there that we've been looking at moving across to some of the interventions that some of the pleasure principles endorsing organizations have been putting into play.
I love that. And PSI, as you know, is also an endorser of the pleasure principles. And this is all part of the work that we're doing, helping support people living happier, healthier lives. Is there anything else that you'd like to tell our audience today, Anne, before we close out?
I'd like to tell the audience to endorse the pleasure principles like the Trailblazers PSI have done. We've now got a growing group of organizations that have taken the step to endorse the pleasure principles. The pleasure principles that you can see here and see on our website are 7 inspirational, fun steps to be able to implement pleasure-based sexual health. That takes all of the available research, great best practices from PSI and other organizations to really show how. So it really breaks it down into fun, simple steps. You just click on them. They give you, for example, Talk Sexy. One of them just tells you how to start the conversation, which you might be worrying how to do. There's also, I mean, the overall basis of the pleasure principles is about flipping the narrative from a negative one to a positive one. They're based on sexual rights. Um, they're about the fact that pleasure is universal, but we need to think about we need to be flexible to people's own lived realities. We need to embrace learning because we need more research on pleasure. But also, we need to love ourselves. We need to be kind to ourselves and recognize that we've all had a range of different journeys and experiences. And, to embrace our own sexuality, our own sexual journey, and also think about ourselves as professionals in this space and what we're actually communicating to the people that we're serving and how we're trying to enable them to have the best pleasurable sexual experiences that they can have.
That is so inspiring. Thank you, Anne. And I'd also like to invite everyone who is interested in learning more about how we are applying this to VIA, which is PSI's Femtech offering, and really looking at breaking down the silos of the way that we're approaching sexual and reproductive health to deliver on a frictionless journey